Hello, I'm Jeannie Poole, Editor-in-Chief of the Heart Rhythm O2 Journal. Thank you for joining us for this edition of the HRO2 Author Interviews. Today I'm here with Dr. David Slotweiner from the Weill Cornell Medical Center and Dr. Sana Al-Khatib from the Duke University Medical Center. Today we're discussing the article Digital Health in Electrophysiology and the COVID-19 Global Pandemic. Thank you both for joining me today to discuss your article, which published in the December 2020 issue of HRO2. I'm going to start out by asking David, you the first question. What prompted you to write this article?
Yeah, thanks, Jeannie, and thanks for inviting us to speak. So digital health has been an interest of mine for some time, but here in the heart of New York, at the peak of the global pandemic, we really learned quickly how much value it could add, not just to telehealth, but to the ongoing patient interactions. I've found it to be an invaluable tool to engage patients in their healthcare and to transform the care model into much more of a longitudinal interaction, often avoiding hospitalizations and helping patients understand their illness much better.
So you all made a lot of really interesting points. So some of my questions now are going to capitalize on some of the points that you made and see if we can dig into that a little bit more. Sana, I'm going to direct this to you. You both made the point that we are dependent upon traditional models of providing care and suggested that these are no longer sufficient to support the management of the deluge of device data and monitoring data. I wondered if you could expand upon that a little bit.
Yeah, no, absolutely. And again, I second what David said. Thank you for the opportunity to speak with you today. Absolutely, the volume of data that we as clinicians and healthcare providers have to review and take care of to be able to deliver the best care to our patients is increasing exponentially. And so it is really important for us to think outside the box and start implementing digital health technologies to help us better capture the data, interpret the data, and provide the care that patients deserve. And as you very well know, we within electrophysiology have been pioneers in many places with regard to digital health, especially with remote monitoring of devices. So we're not starting from scratch, and we're hoping in this to really build on the momentum that we have been able to build so far to see what we can do in terms of how do we ensure that all patients have this type of monitoring, how do we interpret the data in a timely manner, and then communicate with the patients in ways that they can understand, and make sure that the process is seamless, but it's also captured very clearly and accurately within the electronic health record.
Yeah, so very important. David, I wondered if you could have a comment to what Sana talked about. I'm thinking about it from the perspective of us as electrophysiologists and the impact, on our daily lives with trying to meet these current needs.
Absolutely, yeah. Well, I think the deluge of data is something that our traditional healthcare environment has figured out how to manage for most of the data that we gather internally. For example, we get tons of lab results, every day, but we've figured out a good way to just flag the important ones. Same with radiology and other reports, but it's very different now that it's coming from a new source, a new stream. And I don't think the data is terribly different. It's just we don't have that infrastructure built around it. Now, some of that may be able to be taken care of by AI eventually. I think that's quite possible. But we know that interrogations from loop recorders and other wearable devices, still that comes down to humans. But we have humans who do interpret that data for wearable devices that we prescribe, the medical grade devices, for implantable devices. So I don't think what we're talking about in the manuscript is fundamentally different, except it's just a different data stream that we're talking about.
Well, let me just ask you this next question, David. I'll start with you. Is that you mentioned we are moving towards a more patient-centric model. And as I was thinking about that, we commonly use that terminology to express where we're at in this digital age. But I wondered about, is this not also a consumer oriented model? Because it involves partnership with consumers that we have not really partnered with either to this extent or perhaps even new partners. What are your thoughts on that?
Yeah, I think that's a great point. I think it actually points out, what our healthcare system has not been, which is not consumer oriented. I think, consumer oriented products have had to prove themselves in a natural market where healthcare hasn't. And so a patient-centered care is really consumer-centered care. I think they're entirely aligned. But I think it's more satisfying, not just for the patient, but also the provider once we put the right structure around it.
And if I can actually add to that, like the patient-centric care, absolutely, we all have been committed to providing patient-centric care, but I feel like the digital health era has brought forward other opportunities through which we can even make the patient more empowered and more informed, in terms of not only do we get the data, but we share the data. They own the data. So how do we share it with them in a way that they can understand and that can actually help them make the best decisions for themselves? How do we communicate with them effectively and in ways that won't overburden, the healthcare system?
Yeah, I agree. I think that's really an important point, that the patients do feel like they are actually more of a partner now. They're not just listening to what we tell them, but they have that sense of control that you mentioned. I agree with you. I think that that's a really important point.
Yeah.
So Sana, you mentioned also the need to incorporate the data into a longitudinal electronic medical record. And again, just sort of thinking, sort of futuristic as well as practically, given kind of the, small numbers of companies that are involved in this, Epic and then the few others. And do you really think that this is an absolute necessity? Is there another way that we could manage all this data if we can't do that with our current electronic medical record systems?
So, Judy, this is really a very important question. And I feel like the ultimate dream would be to be able to incorporate everything into the electronic health record, but we're very far from that. And the question of whether that's even achievable is a very good one. That remains to be seen. But until we get to that, there are certainly ways through which we can improve the process in terms of ensuring that there is interoperability across the different systems of data collection, across the different sources of data. And so how can we actually ensure this interoperability and ensure a seamless workflow where you have data from different sources that can be well incorporated or integrated is one thing that we have to focus on as a medical community.
David, I bet you have a comment for that
Yeah.
also.
Yeah, thank you, Gina. I think, thinking about a longitudinal health record, if we think about our traditional electronic health records, that's just one potential paradigm. I think ideally, in my ideal imagination, the longitudinal record would be owned by the patient and it would exist somewhere up in the cloud, and they would bring it to their healthcare providers, to help them manage their health when they needed them. But I think there are ways to do a combination of those going forward. We could have our traditional electronic health record somehow access a longitudinal health record that has patient acquired data, like Apple Health right now. So there are a lot of ways to envision this without thinking in the traditional structure that we're used to. I think technology is going to open up a lot of avenues there. But I do think having that in one place, accessible relatively easily for the patients and the providers, is key.
Yeah, I do too. I think that makes sense than having a lot of different systems. But I think you're right that, partnering with some of these consumers that we haven't partnered with in this direct of a model, perhaps, who do data well already, what can we learn from them in management of data and delivery of it, I think is going to be really something we'll need to be exploring in the future. So at an interesting crossroads, I think, in time of thinking about some of these questions.
Yes.
So let's see, I think, David, I'm back to you to start on the next conversation, which I really enjoyed the figure that you provided that shows the difference in the potential workflow using the example, say, remote monitoring. And your figure showed that instead of having all of the data ending up in the hands of one person, i.e. us, the electrophysiologist, instead you've envisioned queuing work streams to sort this out instead, with the idea that there would be individuals at different levels of expertise that would manage parts of this data, which I think is a huge step. And probably what we're doing for those that are already trying to outsource some of this. I think that gets at this idea, but we still have all of these individuals that need to be involved. And again, I sort of come back to what we're facing. I'm sure we're not alone, that it's very hard to find people who have had any kind of experience that you can train up, relatively quickly to be able to manage that. They have to have some sort of clinical expertise. So I'm again thinking very futuristically here. Could you envision a time when machine learning and artificial intelligence just replaces all of those individuals at that point in your queuing work stream? And what we as the physicians see is kind of that final diagnosis, or that final set of alerts, or whatever it would be described as, that we then have to, of course, act on to make the final clinical decisions. But is there something like that you could imagine or envision could potentially be incorporated into our models going forward?
With a very important caveat that I am not an expert in AI. I do think, though, the answer is yes, I do. I am optimistic that we can get there. Now, we're talking about many different types of data, so each different data type has its own challenge, but we've seen in other areas of technology how amazing transformations take place, and how recognizing different patterns. So I don't think it's at all far-fetched to think that, blood pressures, for example, or glucose readings or other labs could easily be, flagged and mostly managed. And even one day, perhaps surface recordings from wearable devices. Right now, there's a lot of artifact, and that's challenging, but I do think in the long run that it's quite realistic to believe that we will have algorithms through AI that will make it much less burdensome on individual providers.
Yeah, absolutely. And to build on that, Jeannie, I actually think there is a place for artificial intelligence in two things in medicine. Diagnosis, so like how can we improve the diagnostic ability, as well as prediction. So like I do feel that once we have all those data in one place, applying some machine learning or deep learning modeling to the data would enable us to do even better in terms of diagnosis and prognostication.
Yeah, those are my thoughts also. I think, again, it'll be really exciting to see where people who are expert in these fields can really help us out with these challenges that we've been talking about today. So I'm going to ask both of you, you can take turns. So David, you can go first, I guess. What key message do you want to leave our readers with?
Well, I think the most important message I'd like to get across is the value that these tools provide in clinical care, and how they can really transform the patient-physician interaction into a much more meaningful, longitudinal, and engaging interaction. I know a lot of our colleagues are concerned about the data inundating them, which I understand. They're also concerned that patients are going to get they're going to start sending them too much data. They're going to get overwhelmed. That's not been my experience. I find that patients learn very quickly how to use these effectively. So my number one message would be, try to take advantage of this. Don't be scared, and help us work on figuring out the workflows and the tools and the research so that we can use these most effectively.
Sana.
Yeah, no, I completely agree with what David said. To me, I think there is a lot of promise in this, and in the ability of digital health to enable us to do better. Of course, there's a vast need for research in terms of understanding the best way to implement these tools and whether implementing them will actually impact patient outcomes and other important outcomes for the healthcare system. And then, of course, beyond that, especially once we have the evidence and the data, it would be great to see professional societies such as the Heart Rhythm Society and others really leading in the era of developing algorithms and perhaps some workflows for practices and hospitals to best apply and implement these tools.
I absolutely agree. So we have come to the end of our time, but I really enjoyed being able to speak with both of you and talk about some of the important points that you made in your article. And I encourage all of our readers to read this great article by Drs. Al-Khatib and Dr. Slotweiner. And again, I thank you both for taking the time today to discuss your article. For Heart Rhythm O2, I'm Jean Poole. Thank you.
Thank you.
Thank you.